about yourself?
I'm good, thank you. I'm here to pick up a new prescription.
Okay. What's the last name?
It's Riveter.
Riveter. First name?
Rosie.
Rosie Riveter. Okay. I do have that medication ready. Let me grab it for you, okay?
Thank you.
Okay. So I have one medication ready. Have you used this medication before?
No, I just got up from the doctor's office, and I heard it's an injection, but I've never used before.
Yeah, actually, it's insulin. It's a Novolin N. It's an injection you're gonna have to do twice daily, morning and evening time. Did the doctor go over it with you? Any directions on how to use it?
To be honest, he was in a hurry, so I didn't have a chance to go over anything. And I was diagnosed with type 1 diabetes.
Okay. So it is an injection. I hope you're not afraid of needles.
To be honest, I am afraid of needles.
Afraid of needles.
Yeah.
Okay. Don't. I know it can be frightening because it is something you're gonna have to use for the rest of your life to control your blood.
For the rest of my life?
Yeah.
But I feel fine. Why do I have to take that?
It's to control your blood glucose levels, so they don't get too high. Because once they get too high, there's some other things that can happen that we don't want to happen. That can have you end up in the emergency department. So to prevent that, it's going to be an injection used 2 times, usually before meals.
Is it painful?
The needles, they're very small, thin needles. You usually won't feel it. You might feel it the first few times since it's something new. But I will go through the whole process with you step by step on how to inject, clean the area, and stuff like that. Does that sound fine?
Yes, that sounds
okay. Okay, so this is your the insulin your doctor prescribed.
Mm-hmm.
It's a 10 ml vial. The name of it is Novolin N. It is cloudy in color, so don't be alarmed. It's nothing to freak out about. That's how it's supposed to be. You're going to inject 10 units subcutaneously every 2 times a day, so morning and evening, about 15 minutes before a meal.
Like breakfast and dinner?
Breakfast and dinner or evening, depends what time you have breakfast and have your dinner. It is to treat manage your type 1 diabetes. It's what we call an intermediate acting insulin. So once it's injected and you inject it into your body, it kind of lingers a little bit. So it kind of brings down your glucose after you eat a meal, and after that, a few hours, lingers in your body to control your glucose levels. After that, okay. So I do have some little sterile water here and some alcohol pads and syringes just to show you. As you said, you never used needles first time. Okay. So I'll go walk you through the process so you could become a little bit more comfortable with it. Okay.
That sounds good.
Okay. So first off, you can inject. There's 4 places you can inject. It's the thigh, arm, in the abdomen. We prefer the abdomen, stomach area. Better absorption there, okay? You do want to do it about 2 to 3 fingers away from your belly button, okay? So the process, the first thing, wash your hands. Wash your hands before and after. When you're about to inject, you're going to want to pinch the skin a little bit, but not too much. You don't want to get any type of muscle on there, okay? So just pinch it, and then when you get this syringe, you want to go at a 90-degree angle, and then inject it. And then once you inject it, leave it in there for about 5 to 10 seconds, and then pull it out. Okay?
5 to 10 seconds.
5 to 10 seconds. So we're sure that all the insulin gets injected. Okay? So what you want to do is wash your hands. Okay? Every time before, also since it's a little cloudy, roll the vial between your hands like that. Okay? Just roll it. And every time, clean the top of the vial with an alcohol swab. You do want to keep it in your, you can keep it in a refrigerator, but preferably you can leave it out for about 28 days. Clean the top, any type of bacteria, anything like that. Okay. Then you want to get the needle. Like I said, the needle, they're very small, thin needles.
It doesn't look too bad, actually.
You shouldn't really feel anything, okay? And then the doctor wants you 10 units 2 times a day. So you want to pull up air about till 10 units, and then inject it. Inject the air into the vial, and then flip it, and then pull out your dose, okay? And then once you pull out your dose, then that's when you go ahead. You also want to swab your stomach area where you're going to inject, okay?
It's not going to be too painful, right?
No, it shouldn't be too painful. So you want to swab the area, pinch it a little bit, and then at a 90-degree angle, put it straight in and inject, okay? Leave there for 10 seconds.
Okay, 10 seconds.
All right, 10 seconds. And one little note, every time you inject, you are going to be doing it 2 times a day. you want to switch the area. So
Switch sides.
yeah, switch sides. Okay. What questions do you have for me? Is it pretty self-explanatory or?
It is. Thank you for explaining. But also, what kind of side effects should I expect?
Okay, Ms. Riveter, there are some side effects I want to go over with you. There's a few actually. The first one is you might see some weight gain.
Weight gain?
Yes, there might be some weight gain. It does vary from person to person. So with that, we try to promote a healthy lifestyle. So with that, obviously managing your blood glucose, healthy diet, along with exercise, daily exercise. Okay. The second thing we like to, as I mentioned before, the injection site, you want to switch, say if you're using it at the abdomen, switch from one side to the next, because there's something we call fat atrophy, which is basically, the tissue tends to die, so it might build up. And to prevent that, we switch the sites, okay? Two other main important ones, there's hypoglycemia, which is low blood glucose. So we are using the insulin to treat and manage your blood glucose, okay? However, when you have your meals, before you eat your meal, you're gonna wanna check your blood glucose with your glucometer at home. You're trying to look for a goal between 80 to 130 before you eat. And then that's when, if it's in that goal, you wanna inject your 10 units. And when you inject, you wanna make sure you are gonna eat that meal after. So if you're planning to skip that meal, then I would suggest don't even inject the insulin, because then that puts you at the risk for hypoglycemia.
Oh, I see.
Okay, and just some little precautions. Hypoglycemia, you might tend to notice, you might feel a little dizzy, sweating, a little unusual and shaky. Okay, so if you are planning on eating that meal, go ahead, inject your 10 units. About 15 minutes, as I said, before your meal. However, if you do start to feel a little shaky, dizzy, unusual, you can go ahead and consume what we call quick sugar. So some examples of quick sugar would be like a half to 1 cup of orange juice. Just go ahead and drink that. So regular orange juice you buy at the supermarket. Gatorade, a cup of Gatorade. So either one of these, orange juice, Gatorade, or at the pharmacy we sell glucose tablets. You go ahead, and most of them come like in fruity flavors. You can chew them, and the goal is to bring your glucose back up. Okay. Check your blood glucose in 15 minutes after you say either have the orange juice, Gatorade, or glucose tablets. And then you also may need to check your blood glucose after you eat, okay, to make sure it's not too high and make sure that the insulin is kind of maintaining it.
Right after eating?
Right after eating, okay? The other side of hypoglycemia is what we call hyperglycemia. That's when your blood glucose gets a little too high, which we don't want, because then we run into another risk of something called diabetic ketoacidosis. So what that is if this happens, you'd want to consider going to the urgent care or calling your doctor right away, okay? More than likely go to the urgent care so they can treat you for these symptoms. This is when the blood glucose, when you test on your glucometer, if it remains over a value of 300, even after, or when your urine ketones remain high after 2 to 3 supplemental doses of insulin. So even though you're using the insulin, you notice, hey, my blood glucose is still at 300 or more. My ketones are still, high. And then allergic reactions there's no allergic reactions really from insulin, just the monitoring of the hypo and hyperglycemia. However, as mentioned, the injection, you just might be like a little local reaction as you start to, something new for you, so you might get a little irritation there. That's normal. Other than that, nothing really to be too concerned about, okay? Just a lot of little monitoring parameters, okay? Okay, Ms. Riveter, just to go over some healthy lifestyle tips just to complement your insulin use. It's important, as I mentioned before, a regular exercise and diet regimen, okay? So with exercise, you want to try to get 150 minutes a week total. That if you want to try to break it down, 30 minutes a day would suffice. Also, your blood glucose when we exercise tends to drop a little bit, so you might want to, while you're exercising, keep a little snack handy. Something you can munch on during the meantime if you feel, like I said before, a little dizzy, something unusual, Also for the diet, eating from your meal to meal, we want to try to keep a balanced meal. So for example, breakfast, lunch, dinner, you don't want to say have a big breakfast, maybe a small lunch, big dinner, and try to keep it balanced out. And we try to use the healthy plate model. So what that is, so for example, say you have your plate, say half of your plate you want to try to use, have vegetables, quarter of it protein, and the other quarter carbs. Okay, so we want to try to minimize the carbs. And then for desserts, obviously sometimes we like to have ice cream or some other stuff like that, a little candy bar. We want to try to limit that. But as long as you're keeping track and not, say eating a whole tub of ice cream, maybe a little, small cupful, or fruit. You don't want to have too much fruit that does have sugar in it as well, okay? You don't want to spike your glucose levels. Some other things your doctor might want to monitor on an ongoing basis is like your cholesterol levels, sodium intakes. You don't want to eat anything too salty, stuff like that. Also, it's good to have a good fiber diet. Have a lot of fiber in your diet. So when you intake fiber, it helps manage your glucose. Kind of gets rid of that as well. You can have the mid-morning. You could have like mid-morning and mid-afternoon snacks. So say between breakfast and lunch, a snack. Nothing too sugary. Maybe try to keep it consistent. A few grams of sugar here and there to keep you going up into your next meal. As I mentioned before, with insulin doses, if you're not going to have that meal, or if you already know ahead of time you're not going to be eating, skip that dose so we don't run into the risk of the hypoglycemia. And then also on the long term, and then about every 3 months, since it's something new you're starting, your doctor's going to want to monitor what we call the hemoglobin A1C, which common A1C levels. He's going to monitor it, make sure that basically the point of that is to monitor measures to make sure your blood glucose has been monitored adequately for the past 3 months. So your doctors will use that to see, is this the right insulin dose for Miss Riveter? Maybe I need to go up on it, lower on it, okay? But if any side effects, as I mentioned, check your blood glucose. If something way out of the ordinary, go to the emergency department, call your doctor. You can call us here at the pharmacy. We'll be more than happy to help you, okay? And help you manage your blood glucose for the long term. What questions do you have for me?
Okay, so I was wondering, where do I keep this medication? Is it good like forever until I'm done with it? Or?
So this medication, if you're not using a vial, you want to keep them in your refrigerator, and those vials are good until the expiration date on the bottle. It is about each bottle. It says expires in about 3 years. However, once you take one vial out and start using it for daily use, you can leave it out for 28 days at room temperature. So, for example, if you have work, you're on the go, you can put it in your purse. I would suggest leaving it in your car because of the heat and stuff like that. But you can keep it out for 28 days. After about 28 days, you are going to have some left over. Even though you have some left over, I know it might seem like a waste, but just discard it. So after 28 days, just get rid of it, toss it, and then start using a new vial. You will have refills to keep you going for your day-to-day injections, okay?
Okay, that makes sense.
And then also another thing with the needles, after you're done, you might want to get a sharps container.
Mm-hmm.
So after you're done with the needles, we don't want to, throw them in the trash or anything like that to prevent any type of contamination. I know at the local stores or here you can buy one. It's a little red container. It's called a sharps container. So after that, you put your needles in there, and after it fills up, you can dispense a bit at a local collection site, okay? So is this something that you think you can manage on a day-to-day basis?
Initially, I was kind of hesitant, but thank you so much for going over. It doesn't look too bad, and the needle is very tiny, so I think I should be okay. I think I can do it.
All right. I'm glad you feel more comfortable with it. If you have any questions, you always give us a call here. We'll be more than happy to help you, manage your blood glucose throughout your time.
Yeah, thank you, Dr. Gonzalez.
Thank you, Miss Riveter.
Sugar, yes, please. Won't you come and put it down on me? I'm right here, 'cause I need it.
Stop.
Wait,
Stop.
what is
What's going on?
Okay, hold on. Okay, Miss Rivet, just a compliment. Why are you laughing?
Wait, what's that?
Miss Rivet.
Rivet.
Riveter.
Riveter. Oh, Miss Riveter.